Hello everyone and welcome back to our channel. If you're new here, I'm here today to help you manage your diabetes and live your healthiest life. Today we're discussing another crucial topic for anyone living with diabetes, diabetic neuropathy. With nearly 50% of diabetics developing this condition, it's vital to recognize the early warning signs to prevent serious complications. In this video, we'll uncover the 7 dangerous warning signs of diabetic neuropathy that you should never ignore. So let's get started. Muscle cramps might seem like a minor inconvenience, but for those managing diabetes, they can be a significant red flag. When your blood sugar levels are high over extended periods, the nerves responsible for muscle movement can become damaged. This damage can lead to painful cramps, particularly in your legs and feet, which might disrupt both your sleep and daily activities. High blood glucose levels can lead to diabetic neuropathy, where nerves lose their ability to communicate effectively. This breakdown in nerve function can result in involuntary muscle contractions, causing those painful cramps. According to a study published in Diabetes Care, nearly 30% of people with diabetes report experiencing muscle cramps as a symptom of diabetic neuropathy, highlighting the importance of early intervention. Muscle cramps can severely impact your quality of life. They often occur at night, disrupting your sleep and leaving you feeling tired and irritable the next day. During the day, these cramps can make walking or standing uncomfortable, affecting your overall mobility and daily activities. In addition to controlling blood sugar, physical therapy has been shown to be effective in managing muscle cramps. A study in the Journal of Diabetes and its Complications found that targeted exercises and stretches could help improve muscle function and reduce cramping. But above all, it is important to stay sufficiently hydrated if you are experiencing muscle cramping. Muscle cramps may seem like just another inconvenience, but they can be an early warning sign of diabetic neuropathy. By staying hydrated, practicing regular stretching, and working with a physical therapist, you can manage these symptoms more effectively. Always remember that maintaining good blood sugar control is essential for protecting your nerves and improving your quality of life. If you're experiencing persistent muscle cramps or other symptoms of diabetic neuropathy, don't hesitate to consult with your healthcare provider for personalized advice and treatment options. Closely related to cramps is muscle weakness. When experienced particularly in the hips, thighs, and buttocks, can be a troubling symptom of diabetic neuropathy, specifically a form known as proximal neuropathy. This condition affects the peripheral nerves that are essential for muscle movement. When these nerves are damaged due to high blood sugar levels, they struggle to send proper signals to your muscles, leading to noticeable weakness and difficulty with movement. Muscle weakness is not uncommon among people with diabetes. Research published in the Journal of Diabetes and its Complications indicates that approximately 20% of diabetic patients experience some degree of muscle weakness. This condition can make everyday tasks challenging, from standing up from a seated position to climbing stairs or even walking. The weakness can significantly impact your mobility and overall quality of life. A study published in Diabetes Care sheds light on how high blood sugar levels contribute to nerve damage and subsequent muscle weakness. The research shows that poorly managed diabetes accelerates the process of nerve degradation, affecting the nerves that control muscle function. This underscores the importance of maintaining good blood glucose control to prevent or slow down the progression of neuropathy. Another closely related issue is muscle weakness. When experienced particularly in the hips, thighs, and buttocks, is a significant and often overlooked sign of diabetic neuropathy that can be mitigated by regular exercise. Our next early warning sign of diabetic neuropathy is numbness in your hands or feet. This symptom is often one of the first signs that something is amiss with your nerve health. When high blood sugar levels persistently damage your nerves, it can lead to a loss of sensation in your extremities. Numbness occurs because elevated glucose levels can injure the peripheral nerves, which are responsible for sending sensory information from your extremities to your brain. According to the American Diabetes Association, this kind of nerve damage primarily affects the peripheral nerves in your feet and hands. As these nerves become compromised, the normal signals they send become disrupted or lost entirely. This disruption makes it difficult to feel sensations, such as touch, pain, or temperature changes. Imagine not being able to feel your feet. This can turn everyday activities like walking or picking up objects into real challenges. Numbness can make you more susceptible to injuries you might not even notice, such as cuts or blisters. This lack of sensation increases the risk of infections and ulcers, which can become severe if left untreated. The American Diabetes Association emphasizes that numbness, especially in the feet, is a critical indicator of diabetic neuropathy. A study published in the Diabetes Care Journal highlights that about 60–70% of individuals with diabetes will experience some form of nerve damage, with numbness being a common early symptom. This study underscores the importance of early detection and management to prevent further complications. It would be wise to regularly check your feet for any injuries or blisters and consult your healthcare provider if you notice persistent numbness. On to the next warning sign is burning sensations in your feet or legs. If you've ever experienced a persistent, uncomfortable burning feeling in your lower limbs, you might be dealing with diabetic neuropathy. This symptom arises when nerve damage from high blood sugar levels causes your nerves to send abnormal signals to your brain, creating that burning or tingling sensation. The Journal of Clinical Endocrinology and Metabolism highlights that these sensations can vary significantly. For some, it's just a mild discomfort, but for others, it can escalate to severe, debilitating pain. This burning sensation often intensifies at night or after extended periods of standing or walking. According to a study published in Diabetes Care, these abnormal nerve signals not only affect your comfort but can also significantly disrupt your daily life and quality of sleep. Managing these burning sensations requires a comprehensive approach. Start by addressing your blood sugar levels. Maintaining them within the target range is crucial in preventing further nerve damage. Additionally, your healthcare provider might suggest medications such as pregabalin or gabapentin, which have been shown to alleviate neuropathic pain effectively. Other strategies include using topical treatments or exploring alternative therapies like acupuncture and transcutaneous electrical nerve stimulation. For a more holistic approach, consider incorporating regular physical activity and avoiding prolonged periods of standing, which can exacerbate symptoms. Number 5 on our list is a critical symptom you should never ignore: loss of balance. When diabetic neuropathy damages the nerves, it can severely affect your body's ability to stay upright and adapt to changes in position. This nerve damage disrupts your sense of coordination, leading to feelings of unsteadiness, frequent tripping, and even falls. According to research published in the Journal of Diabetes Research, impaired balance is a significant risk factor for falls among individuals with diabetic neuropathy. This condition can make even routine activities dangerous, increasing the risk of severe injuries. The American Diabetes Association emphasizes the importance of addressing balance issues proactively. Engaging in physical therapy is highly recommended to enhance stability and coordination. Your physical therapist can provide exercises specifically designed to strengthen your core muscles and improve the sense of your body's position and balance. Additionally, incorporating lifestyle modifications can make a substantial difference. Regular exercise, such as walking or swimming, can improve overall muscle strength and balance. For added safety, using assistive devices like canes or walkers can help maintain your stability and prevent falls. The National Institute of Diabetes and Digestive and Kidney Diseases also suggests that making your home environment safer by removing trip hazards and installing grab bars can reduce the risk of falls. Hair loss on your legs might seem like a trivial issue, but it can actually be a significant warning sign of diabetic neuropathy. This seemingly minor symptom is a telltale sign that your body's circulation and nerve health are compromised. When diabetes causes damage to your peripheral nerves, it can also disrupt blood flow to the extremities, including the hair follicles in your legs. According to a study published in Diabetes Care, decreased blood flow due to nerve damage weakens the hair follicles, leading to noticeable hair loss. This loss of hair can be an early indicator that your circulation is not functioning properly, signaling that there might be more extensive nerve damage. The American Diabetes Association underscores the importance of paying attention to such symptoms as they reflect underlying issues with nerve health and blood flow. Poor circulation can lead to various complications, and hair loss is just one of the visible signs. To address nerve damage effectively, it's crucial to focus on enhancing both blood flow and nerve health. Regular physical activity plays a vital role in this process. Engaging in cardiovascular exercises such as brisk walking or cycling can significantly improve blood circulation and help in managing blood sugar levels. Alongside exercise, maintaining a healthy diet is essential. Incorporate foods rich in antioxidants and healthy fats into your meals, as these nutrient-dense options support the health of nerves and blood vessels. Additionally, avoiding smoking is critical, as it can further impair circulation and worsen nerve damage. If you are a smoker, quitting smoking will greatly benefit your overall health and support your efforts in managing diabetic neuropathy. When it comes to diabetic neuropathy, ulcers and infections in the feet are among the most alarming and severe complications you should be aware of. High blood sugar levels over time can cause significant nerve damage, particularly affecting the sensory nerves in your feet. This nerve damage results in a decreased ability to feel sensations, including pain, which means you might not notice cuts, blisters, or other injuries that can easily become infected. According to a study published in the Journal of Diabetes and Its Complications, approximately 15% of people with diabetes will develop a foot ulcer at some point. Even more concerning, between 14% and 24% of those with foot ulcers may face serious complications that could lead to amputation, especially if infections are not promptly addressed. This underscores the gravity of this symptom and its potential to impact your quality of life profoundly. To protect yourself from these dangerous outcomes, proactive foot care is essential. Regularly inspect your feet for any signs of injury. Keep them clean and moisturized, and wear well-fitting shoes to prevent pressure sores and blisters. It's also crucial to seek medical attention immediately if you notice any abnormalities, as early intervention can prevent minor issues from escalating into severe infections. Staying vigilant about foot health and managing your blood sugar levels effectively are key steps in preventing and addressing ulcers and infections. Taking these precautions seriously can help you avoid some of the more severe consequences associated with diabetic neuropathy and maintain better overall health. There you have it, 7 early and dangerous warning signs of diabetic neuropathy that you should never ignore. If you recognize any of these symptoms, it's essential to take proactive steps and consult with your healthcare provider. We'd love to hear from you. Have you experienced any of these symptoms? Or do you have tips to manage diabetic neuropathy? Share your thoughts in the comments below. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the bell icon so you never miss our latest updates. Thank you for watching, and here's to your health. See you next time.